Hello everyone, and welcome. In today's CNA Knowledge Practice Test Practice session, we'll go through 200 updated questions designed to help you prepare for the exam. When each question appears, pause the video first. Choose the answer you believe is correct, then comment your answer below before resuming the video to see the correct answer. Keep track of your score as you move through the questions, and let's get started. Question 1. Which of the following is not a common sign of stress and burnout in the healthcare industry? Option A, feeling tired even when well rested. Option B, difficulty focusing on residence and job duties. Option C, arguing with supervisors about assignments. Option D, increased enthusiasm for work. The correct answer is option D, increased enthusiasm for work. Explanation. Increased enthusiasm is generally the opposite of stress and burnout. Fatigue, poor focus, and conflict can be warning signs. Question 2. A resident in a nursing facility has developed a urinary tract infection UTI. Which of the following actions should a CNA take to break the chain of infection? Option A, increase the resident's fluid intake to flush out the bacteria. Option B, isolate the resident from others to prevent the spread of infection. Option C, ensure proper hand hygiene before and after providing care. Option D, administer antibiotics as prescribed by a physician. The correct answer is option C, ensure proper hand hygiene before and after providing care. Explanation. Hand hygiene interrupts transmission of microorganisms and is a core step in breaking the chain of infection. Question 3. What is the primary action a certified nursing assistant CNA should take if they suspect a resident is being abused? Option A, document the incident and wait for further instructions. Option B, confront the suspected abuser directly. Option C, remove the resident from harm and report immediately. Option D, inform the resident's family about the situation. The correct answer is option C, remove the resident from harm and report immediately. Explanation. The resident must first be protected from harm, and suspected abuse must be reported immediately through the proper chain of command. Question 4. If a CNA encounters a situation where a resident has ingested a harmful chemical, which of the following steps should they take based on the information provided in the material safety data sheets? Option A, immediately call the resident's family for advice. Option B, refer to the MSDS for specific first aid measures and contact emergency services. Option C, administer water to the resident to dilute the chemical. Option D, wait for a nurse to arrive before taking any action. The correct answer is option B. Refer to the MSDS for specific first aid measures and contact emergency services. Explanation. An MSDS provides chemical-specific first aid and emergency response instructions, which should be followed while emergency help is contacted. Question 5. Which of the following is an example of how infection can be spread by direct contact? Option A, touching an open cut without gloves. Option B, picking up a tissue someone has sneezed in. Option C, picking up dirty linen. Option D, touching a toilet seat. The correct answer is option A, touching an open cut without gloves. Explanation. Touching an open cut without gloves can transfer pathogens directly between people or body tissues. Question 6. Explain why it is important to handle oxygen tanks with care in a healthcare setting. Option A, to prevent theft of the tanks. Option B, to ensure the tanks do not become damaged and leak. Option C, to make them easier to transport. Option D, to comply with insurance regulations. The correct answer is option B, to ensure the tanks do not become damaged and leak. Explanation. To ensure the tanks do not become damaged and leak. This supports safe, effective, and person-centered resident care. Question 7. Why is it important for facilities to honor residents' choices regarding their daily routines, such as showering or bedtime? Option A, it helps to reduce the workload of the staff. Option B, it promotes a sense of autonomy and respect for the residents. Option C, it ensures that all residents follow the same schedule. Option D, it allows for easier management of facility resources. The correct answer is option B. It promotes a sense of autonomy and respect for the residents. Explanation. It promotes a sense of autonomy and respect for the residents. This supports safe, effective, and person-centered resident care. Question 8. Explain why it is important for nurses to trim the toenails of diabetic residents rather than allowing CNAs to do so. Option A. Nurses have more training in foot care. Option B. Diabetic residents have a higher risk of developing foot wounds. Option C. Nurses can provide emotional support during the procedure. Option D. Only nurses can use the necessary tools for toenail trimming. The correct answer is option B. Diabetic residents have a higher risk of developing foot wounds. Explanation. Diabetes can impair circulation and healing, so even a small toenail injury can become a serious wound or infection. Question 9. What is the definition of proper body alignment for residents? Option A. Residents' shoulders are slouched forward, with their head tilted to one side. Option B. Residents' shoulders are directly above their hips, their head and neck straight, their arms and legs in natural positions. Option C. Residents' shoulders are raised, with their head turned away from their body. Option D. Residents' shoulders are rounded, with their arms crossed over their chest. The correct answer is option B. Residents' shoulders are directly above their hips, their head and neck straight, their arms and legs in natural positions. Explanation. Residents' shoulders are directly above their hips, their head and neck straight, their arms and legs in natural positions is the correct term, definition, or identification for this CNA care concept. Question 10. What is the primary tool recommended for turning, lifting, or moving a resident in bed to minimize skin damage from shearing? Option A. Transfer belt. Option B. Draw sheet. Option C. Bed rail. Option D. Pillow. The correct answer is option B. Draw sheet. Explanation. A draw sheet allows staff to lift rather than drag a resident, reducing friction and shearing injury to the skin. Question 11. Why is hand washing instead of using an alcohol-based rub required before leaving the room of a patient with C. diff? Option A. C. diff bacteria can cling to your gloves. Option B. Intense scrubbing needed irritates hands. Option C. Spores of C. diff are not killed by alcohol. Option D. There may be tiny holes in your gloves. The correct answer is option C. Spores of C. diff are not killed by alcohol. Explanation. C. difficile forms spores that alcohol-based hand rubs do not reliably destroy, so soap and water hand washing is required. Question 12. What is the primary reason for cleaning the peri area correctly in patient care? Option A. To ensure comfort for the resident. Option B. To prevent the spread of infection by washing pathogens away from the urethra. Option C. To maintain a pleasant odor. Option D. To promote skin hydration. The correct answer is option B. To prevent the spread of infection by washing pathogens away from the urethra. Explanation. Cleaning from the urethral area toward the anus moves organisms away from the urinary opening and lowers UTI risk. Question 13. A CNA is preparing to assist a resident who has a contagious infection. Which of the following actions demonstrates the correct application of personal protective equipment PPE protocols? Option A. Wearing gloves and a mask only when entering the room. Option B. Using PPE only if the resident shows visible symptoms. Option C. Wearing full PPE, including gloves, gown, and mask, before entering the room and removing it properly afterward. Option D. Wearing PPE only during the procedure and not while interacting with the resident. The correct answer is option C. Wearing full PPE, including gloves, gown, and mask, before entering the room and removing it properly afterward. Explanation. Wearing full PPE, including gloves, gown, and mask, before entering the room and removing it properly afterward is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 14. What is one of the primary responsibilities of a certified nursing assistant CNA in relation to resident rights? Option A. To administer medication to residents. Option B. To report signs of abuse, neglect, or misappropriation immediately. Option C. To conduct physical therapy sessions. Option D. To manage residents' financial accounts. The correct answer is option B. To report signs of abuse, neglect, or misappropriation immediately. Explanation. To report signs of abuse, neglect, or misappropriation immediately is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 15. Explain the significance of the RACE acronym in emergency situations for nursing assistants. Why is each step important? Option A. It helps prioritize tasks during a fire to ensure resident safety. Option B, it provides a checklist for daily routines in patient care. Option C, it outlines the steps for reporting incidents to supervisors. Option D, it serves as a guideline for maintaining hygiene in healthcare settings. The correct answer is option A. It helps prioritize tasks during a fire to ensure resident safety. Explanation. RACE organizes fire response, rescue/remove, alarm, contain, and extinguish or evacuate when safe. Question 16. Why is it important for residents to be released from restraints every 2 hours or less? Option A. To ensure they do not feel abandoned. Option B. To promote physical activity and prevent complications. Option C. To allow staff to monitor their behavior. Option D. To comply with hospital regulations. The correct answer is option B. To promote physical activity and prevent complications. Explanation. Regular release allows repositioning, toileting, movement, circulation checks, and prevention of restraint-related complications. Question 17. A resident in a long-term care facility is showing signs of dehydration. As a CNA, which of the following actions should you prioritize to address this issue? Option A. Encourage the resident to drink water regularly throughout the day. Option B. Limit the resident's fluid intake to prevent frequent bathroom trips. Option C. Provide the resident with high-sugar beverages to increase energy. Option D. Monitor the resident's weight weekly without any intervention. The correct answer is option A. Encourage the resident to drink water regularly throughout the day. Explanation. Encourage the resident to drink water regularly throughout the day is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 18. What is the correct position for oxygen tanks to ensure safety? Option A. Horizontal. Option B. Upright. Option C. Tilted. Option D. In a closed container. The correct answer is option B. Upright. Explanation. Upright is the recommended position because it best addresses the resident's stated care or safety need. Question 19 blank is the term that means a resident has left the nursing home without the staff being aware they are gone. Option A. Distracting. Option B. Wandering. Option C. Elopement. Option D. A and C. The correct answer is option C. Say, elopement. Explanation. Elopement means a resident leaves the facility without staff knowledge or authorization. Question 20. Which of the following are examples of neglect on an elderly person? Option A. Leaving a resident in a wheelchair for 8 hours. Option B. Leaving a food tray out of reach of a bedfast resident. Option C. Waiting till after break to change a soiled incontinent brief. Option D. All of the above. The correct answer is option D, all of the above. Explanation. All of the above is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 21. Which of the following is not a component of the chain of infection? Option A. Causative agent. Option B. Reservoir. Option C. Mode of transmission. Option D. Patient care techniques. The correct answer is option D. Patient care techniques. Explanation. Patient care techniques are not one of the standard links in the chain of infection. Question 22. A CNA is caring for a resident diagnosed with Clostridium difficile. After providing care, what should the CNA do to ensure proper infection control? Option A. Use an alcohol-based hand rub before leaving the room. Option B. Wash hands with soap and water immediately after care. Option C. Wear gloves and not wash hands. Option D. Use a disinfectant spray on hands. The correct answer is option B. Wash hands with soap and water immediately after care. Explanation. Wash hands with soap and water immediately after care. This is the safest immediate response and is consistent with the CNA scope of practice. Question 23. Residents' rights include Option A. Confidentiality and privacy. Option B. Being informed and making decisions. Option C. Voicing grievances and freedom from abuse and restraints. Option D. All of the above. The correct answer is option D. All of the above. Explanation. All of the above is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 24. Why is it important to communicate a resident's condition and toileting history during the shift report? Option A. To ensure the oncoming shift is aware of the resident's needs and can provide appropriate care. Option B. To fill time during the report. Option C. To allow the oncoming shift to socialize with residents. Option D. To prepare for the next staff meeting. The correct answer is option A. To ensure the oncoming shift is aware of the resident's needs and can provide appropriate care. Explanation. To ensure the oncoming shift is aware of the resident's needs and can provide appropriate care. This supports safe, effective, and person-centered resident care. Question 25. Which of the following best describes the difference between objective and subjective observations? Option A. Objective observations are based on personal opinion, while subjective observations are based on empirical evidence. Option B. Objective observations are based on empirical evidence, while subjective observations are based on personal opinion. Option C. Objective observations are influenced by biases, while subjective observations are unbiased. Option D. Objective observations are independent of context, while subjective observations depend on context. The correct answer is option B. Objective observations are based on empirical evidence, while subjective observations are based on personal opinion. Explanation. Objective findings are observable or measurable. Subjective findings are based on what a person reports or feels. Question 26. Which of the following is not one of the 5 moments of hand hygiene for certified nursing assistants? Option A. Before resident contact. Option B. After exposure to blood/body fluids. Option C. Before administering medication. Option D. After contact with resident surroundings. The correct answer is option C. Before administering medication. Explanation. The 5 moments include resident contact, body fluid exposure, aseptic tasks, and resident surroundings. Medication administration is not named as a separate moment. Question 27. The term misappropriation means: Option A. Taking something that does not belong to a person and using it for personal gain. Option B. Handling a resident possessions roughly. Option C. Harming a resident purposefully. Option D. Unlawfully restraining a resident. The correct answer is option A. Taking something that does not belong to a person and using it for personal gain. Explanation. Misappropriation is the wrongful taking or use of another person's property for personal benefit. Question 28. Explain how the proper use of personal protective equipment (PPE) contributes to infection control in healthcare environments. Option A. It allows caregivers to perform tasks without any risk. Option B. It minimizes the risk of pathogen transmission between caregivers and residents. Option C. It is only necessary during surgical procedures. Option D. It eliminates the need for hand hygiene. The correct answer is option B. It minimizes the risk of pathogen transmission between caregivers and residents. Explanation. It minimizes the risk of pathogen transmission between caregivers and residents is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 29. What is the primary purpose of Material Safety Data Sheets (MSDS) in a healthcare setting? Option A. To provide guidelines for emergency procedures. Option B. To outline resident rights. Option C. To detail infection control protocols. Option D. To offer information on chemical hazards and safety. The correct answer is option D. To offer information on chemical hazards and safety. Explanation. MSDS documents identify chemical hazards, safe handling, protective measures, and emergency first aid. Question 30. What is the maximum time interval at which a restrained resident should be monitored? Option A. Every 30 minutes. Option B. Every hour. Option C. Every 2 hours. Option D. Every 3 hours. The correct answer is option B. Every hour. Explanation. A restrained resident should be checked at least hourly, with release and repositioning at least every 2 hours or sooner. Question 31. What is the first action you should take if your clothing catches fire? Option A. Run to the nearest exit. Option B. Stop, drop, and roll. Option C. Call for help. Option D. Use a fire extinguisher. The correct answer is option B. Stop, drop, and roll. Explanation. Stopping, dropping, and rolling smothers flames and reduces continued burning of clothing. Question 32. A CNA notices that a resident has unexplained bruises and appears withdrawn. Based on the types of abuse covered in their training, what should the CNA do next? Option A. Ignore the signs as they may not indicate abuse. Option B. Report the observations to a supervisor immediately. Option C. Confront the resident about the bruises. Option D. Document the observations and wait for further instructions. The correct answer is option B. Report the observations to a supervisor immediately. Explanation. Report the observations to a supervisor immediately. This is the safest immediate response and is consistent with the CNA's scope of practice. Question 33. What is the primary action that can lead to infection through indirect contact? Option A. Washing hands frequently. Option B. Touching a contaminated object and then a person. Option C. Using personal protective equipment. Option D. Isolating infected individuals. The correct answer is option B. Touching a contaminated object and then a person. Explanation. Touching a contaminated object and then a person is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 34. What is the correct range of systolic and diastolic pressure for normal blood pressure? Option A. 120/80. Option B. 140/100. Option C. 160/110. Option D. 90/40. The correct answer is option 120/80. Explanation. A blood pressure around 120/80 mmHg is commonly used as the reference normal adult reading in basic CNA training. Question 35. A resident expresses a desire to change their shower time from the morning to the evening. As a CNA, how should you approach this request to ensure person-centered care? Option A. Inform the resident that the facility has a strict schedule that cannot be changed. Option B. Discuss the request with the resident and accommodate their preference if possible. Option C. Suggest that the resident stick to the original schedule for consistency. Option D. Report the request to the supervisor without discussing it with the resident. The correct answer is option B. Discuss the request with the resident and accommodate their preference if possible. Explanation. Discuss the request with the resident and accommodate their preference if possible is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 36. Explain the concept of validation therapy and its significance in the care of residents in a nursing facility. Option A. It involves correcting residents' misconceptions to align with reality. Option B. It allows residents to express their feelings without judgment. Option C. It helps residents feel understood and accepted in their beliefs. Option D. It focuses solely on physical care without emotional support. The correct answer is option C. It helps residents feel understood and accepted in their beliefs. Explanation. Validation therapy acknowledges the resident's feelings and perceived reality so the person feels understood rather than corrected or argued with. Question 37. What is the primary difference in pressure on the coccyx between the semi-Fowler's position and the Fowler's position? Option A. More pressure. Option B. Less pressure. Option C. No difference. Option D. Variable pressure. The correct answer is option B. Less pressure. Explanation. Semi-Fowler's uses a lower head of bed angle, which generally produces less sliding and coccyx pressure than full Fowler's. Question 38. A nursing assistant is preparing to dress a patient's wounds. The patient has injuries on both arms, one of which is severely affected. How should the nursing assistant proceed with the dressing process? Option A. Dress the non-affected arm first to keep the patient comfortable. Option B. Dress both arms at the same time to save time. Option C. Dress the affected arm first to address the more serious injury. Option D. Consult with a nurse before proceeding with any dressing. The correct answer is option C. Dress the affected arm first to address the more serious injury. Explanation. Dress the affected arm first to address the more serious injury is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 39. During a fire emergency in a nursing facility, You encounter a fire in a residence room. Using the PASS technique, what is your first action? Option A. Squeeze the handle of the fire extinguisher immediately. Option B. Aim the nozzle at the base of the flame. Option C. Pull the pin on the fire extinguisher to prepare it for use. Option D. Sweep back and forth at the base of the flame. The correct answer is option C. Pull the pin on the fire extinguisher to prepare it for use. Explanation. PASS begins by pulling the extinguisher pin before aiming, squeezing, and sweeping. Question 40. Why is it important to ensure that a resident's eyeglasses are clean before assisting them? Option A. To prevent scratches on the lenses. Option B. To enhance the resident's visual clarity and comfort. Option C. To comply with safety regulations. Option D. To reduce the need for frequent replacements. The correct answer is option B. To enhance the resident's visual clarity and comfort. Explanation. To enhance the resident's visual clarity and comfort. This supports safe, effective, and person-centered resident care. Question 41. What type of abuse involves infliction of mental anguish that is threatening/intimidating? Option A. Sexual abuse. Option B. Neglect. Option C. Physical abuse. Option D. Emotional abuse. The correct answer is option D. Emotional abuse. Explanation. Emotional abuse is the correct term, definition, or identification for this CNA care concept. Question 42. A CNA is caring for a resident who has recently undergone surgery and is at risk for infection. How should the CNA approach peri-area cleaning to minimize infection risk? Option A. Clean the area quickly without focusing on technique to save time. Option B. Use a gentle wiping motion from the urethra toward the anus to ensure pathogens are moved away from the urethra. Option C. Use the same cloth for multiple residents to reduce waste. Option D. Only clean the area if the resident complains of discomfort. The correct answer is option B. Use a gentle wiping motion from the urethra toward the anus to ensure pathogens are moved away from the urethra. Explanation. Use a gentle wiping motion from the urethra toward the anus to ensure pathogens are moved away from the urethra is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 43. What is the normal range for pulse rate in beats per minute as recognized in CNA training? Option A. 50 minutes 80 beats per minute. Option B. 60 minutes 100 beats per minute. Option C. 70 minutes 110 beats per minute. Option D. 80 minutes 120 beats per minute. The correct answer is option B. 60 minutes 100 beats per minute. Explanation. The commonly taught normal resting adult pulse range is 60 to 100 beats per minute. Question 44. Explain why hand hygiene is considered the most crucial action in infection control for certified nursing assistants. Option A. It eliminates the need for personal protective equipment. Option B. It reduces the transmission of pathogens from one person to another. Option C. It is the only method to prevent infection. Option D. It is a legal requirement for healthcare workers. The correct answer is option B. It reduces the transmission of pathogens from one person to another. Explanation. It reduces the transmission of pathogens from one person to another. This supports safe, effective, and person-centered resident care. Question 45. The record of person items brought to the facility and belonging to the resident is Option A. Advanced directives. Option B. Admission agreement. Option C. Personal inventory record. Option D. Personal profile. The correct answer is option C. Personal inventory record. Explanation. Personal inventory record is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 46. Which of the following items is not typically used to promote reality orientation for residents? Option A. Calendar. Option B. Clock. Option C. Familiar pictures. Option D. Television. The correct answer is option D. Television. Explanation. Television is the exception. The other choices are recognized signs, components, rights, or recommended practices. Question 47. What is the term used to describe the blue discoloration of skin and mucous membranes? Option A. Hypoxia. Option B. cyanosis. Option C, jaundice. Option D, pallor. The correct answer is option B, cyanosis. Explanation. Cyanosis is a bluish discoloration associated with inadequate oxygenation and requires prompt reporting. Question 48. Increase in negative and difficult behaviors during evening and nighttime hours, not a disease but a symptom, reversing day and night behavior. Option A, depression. Option B, sundowner's syndrome. Option C, anxiety. Option D, dementia. The correct answer is option B, sundowner's syndrome. Explanation. Sundowning describes increased confusion, agitation, or difficult behavior later in the day or at night. Question 49. If a CNA discovers that a resident's personal belongings are missing, what should be the first step they take in accordance with their training on misappropriation? Option A. Confront the resident about the missing items. Option B. Report the incident to their supervisor immediately. Option C. Search the facility for the missing items. Option D. Ignore the situation if the resident seems unconcerned. The correct answer is option B. Report the incident to their supervisor immediately. Explanation. Report the incident to their supervisor immediately. This is the safest immediate response and is consistent with the CNA's scope of practice. Question 50. Why is it important to place the chair on the resident's stronger side during a transfer? Option A. To make the transfer easier for the CNA. Option B. To ensure the resident feels more secure. Option C. To minimize the risk of falls. Option D. All of the above. The correct answer is option D. All of the above. Explanation. Using the stronger side supports the resident's movement, improves stability, and lowers fall risk during transfer. Question 51. What is the primary method for checking a resident's respirations while they are asleep? Option A. Observe the resident's facial expressions. Option B. Place a stethoscope on the resident's chest. Option C. Place a hand on the resident's chest to feel the rise and fall. Option D. Count the number of times the resident coughs. The correct answer is option C. Place a hand on the resident's chest to feel the rise and fall. Explanation. A hand placed lightly on the chest can detect and count each rise and fall without waking the resident. Question 52. An accurate description of restorative resident care is: Option A. Diagnosing medical problems to prevent disease. Option B. Scheduling res care to equalize the workload for care staff. Option C. Helping the resident attain and maintain the highest level of function. Option D. Restocking supplies so that res care is provided efficiently and completely. The correct answer is option C. Helping the resident attain and maintain the highest level of function. Explanation. Restorative care helps a resident reach and maintain the highest practical level of function and independence. Question 53. Why is it important for CNAs to follow the correct procedure when correcting charting errors? Option A. To ensure that the medical record remains accurate and legally defensible. Option B. To make the charting process quicker and easier. Option C. To avoid having to report the error to a supervisor. Option D. To prevent residents from seeing the mistakes. The correct answer is option A. To ensure that the medical record remains accurate and legally defensible. Explanation. To ensure that the medical record remains accurate and legally defensible. This supports safe, effective, and person-centered resident care. Question 54. What are the 4 primary bed positions commonly used in patient care? Option A. Supine, lateral, semi-Fowlers, Fowlers. Option B. Prone, lateral, Trendelenburg, supine. Option C. Fowlers, prone, supine, Trendelenburg. Option D. Semi-Fowlers, supine, lateral, prone. The correct answer is option A. Supine, lateral, semi-Fowlers, Fowlers. Explanation. Supine, lateral, semi-Fowlers, and Fowlers are common bed positions used for comfort, care, and breathing support. Question 55. In a scenario where a fire alarm goes off in a nursing facility, you find that some residents are unable to evacuate quickly. Based on the RACE protocol, what should be your immediate course of action? Option A. Attempt to extinguish the fire before evacuating anyone. Option B. Activate the alarm and begin evacuating residents immediately. Option C. Remove residents from the area, activate the alarm, and contain the fire if safe to do so. Option D. Call emergency services and wait for instructions before taking any action. The correct answer is option C. Remove residents from the area, activate the alarm, and contain the fire if safe to do so. Explanation. RAC prioritizes removing people in danger, activating the alarm, containing the fire, and extinguishing or evacuating if safe. Question 56. Which of the following actions is considered a form of misappropriation by a certified nursing assistant CNA? Option A. A CNA providing extra snacks to a resident without permission. Option B. A CNA using a resident's personal phone to make calls. Option C. A CNA assisting a resident with their daily activities. Option D. A CNA reporting a resident's change in condition to a nurse. The correct answer is option B. A CNA using a resident's personal phone to make calls. Explanation. A CNA using a resident's personal phone to make calls is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 57. What are the three categories of thickened liquids used in patient care? Option A. Syrup, gel, and foam. Option B. Nectar, honey, and pudding. Option C. Cream, juice, and broth. Option D. Water, milk, and tea. The correct answer is option B. Nectar, honey, and pudding. Explanation. The standard thickened liquid levels commonly taught are nectar, honey, and pudding consistency. Question 58. A resident in a long-term care facility suddenly exhibits cold/clammy skin and begins to shake. As a CNA, what is the most appropriate immediate action you should take? Option A. Administer insulin as prescribed. Option B. Provide the resident with a sugary snack or drink. Option C. Call for the nurse and document the symptoms. Option D. Reassure the resident and monitor their vital signs. The correct answer is option B. Provide the resident with a sugary snack or drink. Explanation. Cold, clammy skin and shaking can indicate hypoglycemia. A conscious resident may need a rapid source of sugar while the nurse is notified. Question 59. Why is it important for a certified nursing assistant CNA to remain calm when dealing with a combative resident? Option A. To avoid escalating the situation and ensure safety. Option B. To show authority over the resident. Option C. To distract the resident from their behavior. Option D. To make the resident feel guilty about their actions. The correct answer is option A. To avoid escalating the situation and ensure safety. Explanation. To avoid escalating the situation and ensure safety. This supports safe, effective, and person-centered resident care. Question 60. A resident with a history of pressure ulcers is being repositioned. Which position should a CNA choose to minimize pressure on the coccyx while ensuring the resident is comfortable and safe? Option A. Fowler's position. Option B. Supine position. Option C. Semi-Fowler's position. Option D. Prone position. The correct answer is option C. Semi-Fowler's position. Explanation. Semi-Fowler's reduces the head of bed angle and helps limit sliding pressure over the coccyx. Question 61. What is considered the most essential nutrient for human life according to the CNA guidelines? Option A. Carbohydrates. Option B. Proteins. Option C. Vitamins. Option D. Water. The correct answer is option D. Water. Explanation. Water is essential for hydration, circulation, temperature control, digestion, and other basic body functions. Question 62. What is a key consideration when applying elastic or compression stockings to a resident? Option A. Ensure the stockings are of the correct size. Option B. Check for any skin irritations. Option C. Make sure there are no wrinkles or twists in the stockings. Option D. Apply lotion before putting on the stockings. The correct answer is option C. Make sure there are no wrinkles or twists in the stockings. Explanation. Make sure there are no wrinkles or twists in the stockings is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 63. Why is it important to avoid wrinkles or twists in elastic/compression stockings when dressing a resident? Option A. It enhances the aesthetic appearance of the stockings. Option B, it prevents discomfort and potential skin issues for the resident. Option C, it allows for easier removal of the stockings. Option D, it ensures the stockings are made from breathable material. The correct answer is option B. It prevents discomfort and potential skin issues for the resident. Explanation. It prevents discomfort and potential skin issues for the resident. This supports safe, effective, and person-centered resident care. Question 64. Explain why it is important to keep the head of the bed elevated for residents with feeding tubes. Option A, to improve comfort. Option B, to prevent aspiration. Option C, to facilitate digestion. Option D, to reduce pressure sores. The correct answer is option B, to prevent aspiration. Explanation. Keeping the head elevated during tube feeding reduces the chance that formula will enter the airway. Question 65. What are the primary reasons for the use of an IV or PICC line in patient care? Option A, to administer nutrition, medications, or blood. Option B, to monitor vital signs. Option C, to provide physical therapy. Option D, to conduct psychological assessments. The correct answer is option A, to administer nutrition, medications, or blood. Explanation. IV and PICC lines provide venous access for substances such as nutrition, medications, and blood products. Question 66. Explain the difference between a delusion and a hallucination in the context of mental health. Option A. A delusion involves false beliefs, while a hallucination involves perceiving things that are not present. Option B. A delusion is a sensory experience, while a hallucination is a false belief. Option C. Both terms refer to the same phenomenon. Option D. A delusion is a temporary state, while a hallucination is permanent. The correct answer is option A. A delusion involves false beliefs, while a hallucination involves perceiving things that are not present. Explanation. A delusion is a fixed false belief, whereas a hallucination is a sensory perception without an external stimulus. Question 67. Why is maintaining proper body alignment important for residents in a healthcare setting? Option A. It enhances the aesthetic appearance of the residents. Option B. It prevents discomfort and reduces the risk of injury or pressure sores. Option C. It allows residents to engage in more social activities. Option D. It ensures that residents can eat and drink more efficiently. The correct answer is option B. It prevents discomfort and reduces the risk of injury or pressure sores. Explanation. It prevents discomfort and reduces the risk of injury or pressure sores is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 68. What term is used to describe the planned approach that maintains a resident's level of functioning achieved through rehabilitation? Option A. Rehabilitative care. Option B. Restorative care. Option C. Palliative care. Option D. Preventive care. The correct answer is option B. Restorative care. Explanation. Restorative care is the planned care used to preserve or improve function gained through rehabilitation. Question 69. A resident is found slumped in their chair with their shoulders rounded and head tilted forward. As a CNA, what immediate action should you take to ensure proper body alignment? Option A. Leave the resident as they are, as they may be comfortable. Option B. Adjust the resident's position by straightening their back, aligning their shoulders above their hips, and ensuring their head and neck are straight. Option C. Ask the resident if they want to change their position. Option D. Call for assistance from a nurse before making any adjustments. The correct answer is option B. Adjust the resident's position by straightening their back, aligning their shoulders above their hips, and ensuring their head and neck are straight. Explanation. Adjust the resident's position by straightening their back, aligning their shoulders above their hips, and ensuring their head and neck are straight. This is the safest immediate response and is consistent with the CNA scope of practice. Question 70. Why is it important for residents to cleanse themselves before providing a clean catch urine specimen? Option A. To ensure the specimen is collected quickly. Option B. To prevent contamination and ensure accurate test results. Option C. To reduce the discomfort of the collection process. Option D. To comply with hospital regulations. The correct answer is option B. To prevent contamination and ensure accurate test results. Explanation. Cleansing before a clean catch specimen reduces contamination from skin and genital microorganisms. Question 71. Explain the significance of the PASS technique in fire safety for certified nursing assistants CNAs. Option A. It helps CNAs remember how to evacuate residents during a fire. Option B. It provides a systematic approach to using a fire extinguisher effectively. Option C. It outlines the steps for reporting a fire incident to authorities. Option D. It emphasizes the importance of resident rights during emergencies. The correct answer is option B. It provides a systematic approach to using a fire extinguisher effectively. Explanation. PASS gives a step-by-step method for operating a fire extinguisher safely and effectively. Question 72. A resident in a long-term care facility is observed to be moaning and holding their abdomen. As a CNA, what should be your immediate course of action? Option A. Ignore the signs and continue with your tasks. Option B. Document the behavior and wait for the nurse to assess the resident later. Option C. Report the signs of pain to the nurse and assist the resident in a comfortable position. Option D. Provide the resident with pain medication without consulting a nurse. The correct answer is option C. Report the signs of pain to the nurse and assist the resident in a comfortable position. Explanation. Report the signs of pain to the nurse and assist the resident in a comfortable position. This is the safest immediate response and is consistent with the CNA scope of practice. Question 73. Explain why it is important to dress affected limbs before non-affected limbs in patient care. Option A. To save time during the dressing process. Option B. To prevent further injury and promote healing. Option C. To ensure the patient is comfortable. Option D. To comply with hospital regulations. The correct answer is option B. To prevent further injury and promote healing. Explanation. Placing clothing on the affected limb first reduces pulling and unnecessary movement of the weaker or injured side. Question 74. A CNA is caring for a patient who has difficulty breathing. Which bed position should the CNA use to best assist this patient, and why? Option A. Supine, to provide full support. Option B. Prone, to improve lung expansion. Option C. Semi-Fowlers, to enhance respiratory function. Option D. Trendelenburg, to increase blood flow to the brain. The correct answer is option C. Semi-Fowlers, to enhance respiratory function. Explanation. Semi-Fowlers raises the upper body, improving chest expansion and making breathing easier. Question 75. What is the guideline regarding smoking in areas where oxygen is used or stored? Option A. Yes, it is allowed. Option B. No, it is prohibited. Option C. Only if the oxygen is turned off. Option D. Only in designated smoking areas. The correct answer is option B. No, it is prohibited. Explanation. No, it is prohibited is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 76. Many facilities use the term RCE to help staff recall appropriate fire response procedures. All of the following are part of this acronym except Option A. Remove persons in danger. Option B. Contain the fire. Option C. Act with haste. Option D. Extinguish the fire only if safe. The correct answer is option C. Act with haste. Explanation. Act with haste is not one of the words represented by RACE. Question 77. Which of the following is not a recommended action when a resident becomes combative? Option A. Remain calm and step out of the way. Option B. Remove other residents from the area. Option C. Strike back in self-defense. Option D. Leave the resident alone to calm down if safe. The correct answer is option C. Strike back in self-defense. Explanation. Strike back in self-defense is the exception. The other choices are recognized signs, components, rights, or recommended practices. Question 78. Residents have a right to be free of abuse, neglect, exploitation, and theft. Which of the following statements is true regarding this right? Option A. Suspicions that a nursing home resident may have been a victim of a crime must be reported to authorities immediately. Option B. Any employee who suspects a resident has been abused or neglected must report it to the administrator before the completion of the shift. Option C. Allegations of any type of abuse must be reported to the state agency within 12 hours of the discovery of the incident. Option D. The investigation of any alleged abuse must be completed and reported to the state agency within 5 days of the incident. The correct answer is option A. Suspicions that a nursing home resident may have been a victim of a crime must be reported to authorities immediately. Explanation. Suspected crimes against residents require prompt reporting to the appropriate authorities under resident protection rules. Question 79. Which of the following is an example of a resident's choice that can be honored by a facility to promote person-centered care? Option A. The type of food served in the dining hall. Option B. The time to be woken up and dressed in the morning. Option C. The staff members assigned to their care. Option D. The colors of the room decor. The correct answer is option B. The time to be woken up and dressed in the morning. Explanation. The time to be woken up and dressed in the morning is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 80. If a resident is experiencing difficulty breathing and requests an increase in their oxygen level, what should a CNA do in accordance with their training? Option A. Immediately increase the oxygen level as requested. Option B. Notify a licensed nurse or healthcare professional about the resident's condition. Option C. Reassure the resident and ignore the request. Option D. Document the request and wait for the resident to calm down. The correct answer is option B. Notify a licensed nurse or healthcare professional about the resident's condition. Explanation. Notify a licensed nurse or healthcare professional about the resident's condition. This is the safest immediate response and is consistent with the CNA scope of practice. Question 81. If a resident is observed clutching their throat and unable to speak, what is the most appropriate immediate action a certified nursing assistant should take? Option A. Ask the resident if they are choking. Option B. Perform the Heimlich maneuver. Option C. Call for a nurse and wait. Option D. Provide water to the resident. The correct answer is option B. Perform the Heimlich maneuver. Explanation. Inability to speak while clutching the throat signals severe choking and calls for immediate abdominal thrusts and emergency assistance. Question 82. What is the first step in cleaning the peri area of a male resident? Option A. Wash the scrotum and inner thighs. Option B. Pull back the foreskin. Option C. Rinse the tip of the penis. Option D. Use a different part of the washcloth for each stroke. The correct answer is option B. Pull back the foreskin. Explanation. For an uncircumcised male, the foreskin is gently retracted before cleaning the glands and must be returned afterward. Question 83. A resident is instructed to provide a clean catch urine specimen, but is unsure how to proceed. As a CNA, how would you guide them through the process to ensure the specimen is collected correctly? Option A. Instruct them to collect the urine in any container available. Option B. Advise them to urinate into the toilet first, then into the container after cleansing. Option C. Tell them to urinate directly into the container without any preparation. Option D. Explain the need to wash the hands before and after the collection process. The correct answer is option B. Advise them to urinate into the toilet first, then into the container after cleansing. Explanation. A clean catch specimen is obtained after cleansing and beginning to urinate, with the midstream urine collected in the container. Question 84. If a new resident appears anxious and withdrawn upon arrival, which of the following actions should a CNA prioritize to help ease the resident's transition? Option A. Immediately refer the resident to a psychologist for evaluation. Option B. Introduce yourself and explain your role while encouraging the resident to ask questions. Option C. Focus solely on completing the admission paperwork. Option D. Avoid interaction until the resident becomes more comfortable. The correct answer is option B. Introduce yourself and explain your role while encouraging the resident to ask questions. Explanation. Introduce yourself and explain your role while encouraging the resident to ask questions is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 85. Why is it important for certified nursing assistants CNAs to understand contractures when providing resident care? Option A. To ensure residents are comfortable at all times. Option B. To prevent permanent damage to joints and muscles through proper care techniques. Option C. To recognize signs of infection in residents. Option D. To assist in the administration of medications. The correct answer is option B. To prevent permanent damage to joints and muscles through proper care techniques. Explanation. Range of motion and positioning measures help prevent or limit permanent shortening and stiffening of muscles and joints. Question 86. What is the primary reason CNAs are not permitted to adjust the level of oxygen for residents? Option A. They lack the necessary training to manage oxygen levels. Option B. Oxygen adjustments can only be made by licensed healthcare professionals. Option C. It is against the facility's policy. Option D. CNAs are not allowed to handle any medical equipment. The correct answer is option B. Oxygen adjustments can only be made by licensed healthcare professionals. Explanation. Oxygen is a prescribed treatment, so only licensed personnel may change the ordered flow rate. Question 87. If a CNA realizes they have incorrectly charted a resident's vital signs, what should they do after drawing a line through the error? Option A. Leave the error as is and inform the nurse later. Option B. Write the correct vital signs, initial and date the correction. Option C. Erase the error completely and write the correct information. Option D. Notify the resident about the error and ask for their input. The correct answer is option B. Write the correct vital signs, initial and date the correction. Explanation. A charting error is corrected with a single line, followed by the accurate entry, initials, and date or time according to policy. Question 88. What does PROM stand for in the context of range of motion exercises? Option A. Passive range of motion. Option B. Primary range of motion. Option C. Prolonged range of motion. Option D. Progressive range of motion. The correct answer is option A. Passive range of motion. Explanation. PROM means passive range of motion, in which another person moves the resident's joints without the resident's effort. Question 89. Which of the following observations during oral care should be reported to a nurse? Option A. Presence of fresh breath. Option B. Irritation and raised areas in the mouth. Option C. Normal gum color. Option D. Absence of mouth pain. The correct answer is option B. Irritation and raised areas in the mouth. Explanation. Irritation and raised areas in the mouth is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 90. Explain the importance of using a different part of the washcloth for each stroke when cleaning the peri area of a female resident. Option A. It helps to save time during the cleaning process. Option B. It prevents cross-contamination and maintains hygiene. Option C. It ensures that the entire area is cleaned thoroughly. Option D. It allows for a more comfortable experience for the resident. The correct answer is option B. It prevents cross-contamination and maintains hygiene. Explanation. Using a clean section for each stroke prevents organisms from being carried back toward the urethra. Question 91. Which of the following is not a symptom of dehydration? Option A. Dry mouth. Option B. Weight loss. Option C. Cracked lips. Option D. Increased appetite. The correct answer is option D. Increased appetite. Explanation. Increased appetite is not a typical dehydration symptom. Dry mouth, cracked lips, and weight loss can be. Question 92. Explain the significance of recognizing mottling in patients and what it may indicate about their health status. Option A. It indicates a healthy circulation. Option B. It may suggest poor circulation or impending death. Option C. It is a normal aging process. Option D. It is a sign of an allergic reaction. The correct answer is option B. It may suggest poor circulation or impending death. Explanation. Mottled or blotchy skin can reflect reduced circulation and may occur as death approaches. Question 93. What specific details should be included in the report to the oncoming shift regarding resident care? Option A. Only the names of the residents. Option B. Any changes in resident conditions and their last toileting time. Option C. The schedule for the day. Option D. Personal opinions about the residents. The correct answer is option B. Any changes in resident conditions and their last toileting time. Explanation. Any changes in resident conditions and their last toileting time is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 94. What are some common reasons a patient might deny experiencing pain? Option A. Fear of addiction to pain medication. Option B. Desire to appear strong. Option C. Belief that pain is a normal part of aging. Option D. Fear of medical procedures. The correct answers are options A and B and C and D. Option A. Fear of addiction to pain medication. Option B. Desire to appear strong. Option C. Belief that pain is a normal part of aging. Option D. Fear of medical procedures. Explanation. Patients may underreport pain because of addiction fears, a wish to appear strong, beliefs that pain is normal, or fear of procedures. Question 95. What is a key characteristic that distinguishes a clean catch urine specimen from a routine urine specimen? Option A. A clean catch specimen is collected after a full bladder is emptied. Option B. A clean catch specimen requires the use of a sterile container. Option C. A clean catch specimen involves cleansing the genital area before collection. Option D. A clean catch specimen is collected at a specific time of day. The correct answer is option C. A clean catch specimen involves cleansing the genital area before collection. Explanation. A clean catch specimen specifically requires cleansing the genital area before collecting midstream urine. Question 96. Explain why smoking is not permitted in areas where oxygen is used or stored. Option A. It can cause a fire hazard. Option B. It is a personal choice. Option C. It does not affect oxygen levels. Option D. It is only a recommendation. The correct answer is option A. It can cause a fire hazard. Explanation. It can cause a fire hazard is the exception. The other choices are recognized signs, components, rights, or recommended practices. Question 97. Why is it important for a certified nursing assistant CNA to report observations such as a coated tongue or sores during oral care? Option A. These observations are common and do not require attention. Option B. They may indicate underlying health issues that need medical evaluation. Option C. They are only relevant if the resident complains of pain. Option D. They can be treated with over-the-counter medication. The correct answer is option B. They may indicate underlying health issues that need medical evaluation. Explanation. They may indicate underlying health issues that need medical evaluation. This supports safe, effective, and person-centered resident care. Question 98. IV/PICC lines are used to administer which of the following to the resident's circulation via a vein? Option A. Nutritional substances. Option B. Blood. Option C. Fluids. Option D. Medications. The correct answers are options A and B and C and D. Option A. Nutritional substances. Option B. Blood. Option C. Fluids. Option D. Medications. Explanation. IV and PICC access can deliver nutritional solutions, blood products, fluids, and medications directly into venous circulation. Question 99. Why is it crucial for a CNA to report suspected abuse immediately after ensuring a resident's safety? Option A. To avoid legal repercussions for themselves. Option B. To ensure the resident receives appropriate care and protection. Option C. To maintain a good relationship with the resident's family. Option D. To fulfill personal obligations as a caregiver. The correct answer is option B. To ensure the resident receives appropriate care and protection. Explanation. To ensure the resident receives appropriate care and protection is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 100. Explain the rationale behind the stop, drop, and roll technique when dealing with clothing fires. Option A. It helps to smother the flames and prevent further injury. Option B. It allows you to escape quickly. Option C. It is a method to signal for help. Option D. It cools down the body temperature. The correct answer is option A. It helps to smother the flames and prevent further injury. Explanation. Stopping movement, dropping to the ground, and rolling helps smother flames and limit burn injury. Question 101. Which of the following is an example of neglect in a nursing care setting? Option A. Providing timely medication to residents. Option B. leaving a resident without assistance in a dangerous situation. Option C, engaging residents in recreational activities. Option D, ensuring residents have access to their personal belongings. The correct answer is option B, leaving a resident without assistance in a dangerous situation. Explanation. Leaving a resident without assistance in a dangerous situation is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 102. If a CNA observes a resident showing unexplained bruises and signs of withdrawal, what should be the CNA's immediate course of action to protect the resident's rights? Option A. Discuss the observations with other staff members to gather opinions. Option B. Document the observations and wait for the next shift to report. Option C. Report the signs of abuse or neglect immediately to the appropriate authorities. Option D. Confront the resident to ask how they got the bruises. The correct answer is option C. Report the signs of abuse or neglect immediately to the appropriate authorities. Explanation. Report the signs of abuse or neglect immediately to the appropriate authorities. This is the safest immediate response and is consistent with the CNA's scope of practice. Question 103. When observing a stump amputated area, what should be reported? Option A. Smooth skin without reddened areas. Option B. Redness, warmth, or tenderness. Option C. Dry, intact skin. Option D. Healed incision area. The correct answer is option B. Redness, warmth, or tenderness. Explanation. Redness, warmth, or tenderness at an amputation site may signal irritation or infection and should be reported. Question 104. Which of the following are signs and symptoms of pain? Option A. Changes in vital signs. Option B. Nausea, vomiting, sweating. Option C. Moaning, groaning, or breathing heavy. Option D. All of the above. The correct answer is option D. All of the above. Explanation. Pain can cause vital sign changes, nausea or sweating, and behaviors such as moaning or heavy breathing. Question 105. Explain the significance of using thickened liquids for residents with swallowing difficulties. Option A. They enhance the flavor of the liquids. Option B. They help prevent aspiration and choking. Option C. They are easier to prepare than regular liquids. Option D. They are more nutritious than regular liquids. The correct answer is option B. They help prevent aspiration and choking. Explanation. Thickened liquids move more slowly and are easier to control, reducing aspiration and choking risk in dysphagia. Question 106. What is the recommended method for hand hygiene after contact with Clostridium difficile? Option A. Using an alcohol-based hand rub. Option B. Washing hands with soap and water. Option C. Using hand sanitizer. Option D. Wiping hands with a disinfectant cloth. The correct answer is option B. Washing hands with soap and water. Explanation. Washing hands with soap and water is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 107. Mottling is a medical term often associated with option A. A change in skin color, often seen as purple or blotchy, indicating poor blood circulation. Option B. Excessive perspiration during physical activity. Option C. A skin condition characterized by dark patches on the skin. Option D. Skin dryness and flakiness due to dehydration. The correct answer is option A. A change in skin color, often seen as purple or blotchy, indicating poor blood circulation. Explanation. Mottling is a purple or blotchy skin color change associated with poor peripheral circulation. Question 108. What is one important step to take when assisting a resident with their eyeglasses? Option A. Ensure the glasses are the correct prescription. Option B. Make sure the glasses are clean. Option C. Adjust the glasses for comfort. Option D. Store the glasses in a safe place. The correct answer is option B. Make sure the glasses are clean. Explanation. Make sure the glasses are clean is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 109. A CNA is preparing to leave a resident's room after providing care. The resident is unable to reach the call light due to a recent surgery. What should the CNA do to ensure the resident's safety? Option A. Leave the room and check on other residents. Option B. Place the call light within the resident's reach and inform them how to use it. Option C. Ask the resident to call for help if needed. Option D. Turn off the call light to avoid distractions. The correct answer is option B. Place the call light within the resident's reach and inform them how to use it. Explanation. Place the call light within the resident's reach and inform them how to use it. This is the safest immediate response and is consistent with the CNA scope of practice. Question 110. Why is it important for certified nursing assistants to know the normal pulse rate range? Option A. To diagnose medical conditions. Option B. To monitor residents' health and detect abnormalities. Option C. To administer medications. Option D. To perform surgical procedures. The correct answer is option B. To monitor residents' health and detect abnormalities. Explanation. To monitor residents' health and detect abnormalities. This supports safe, effective, and person-centered resident care. Question 111. Which type of observation involves information that is directly observed through the senses? Option A. Objective. Option B. Subjective. Option C. Interpreted. Option D. Assumed. The correct answer is option A. Objective. Explanation. Objective observations are obtained directly through sight, hearing, touch, smell, or measurement. Question 112. A nursing assistant observes that a resident's lips and fingertips have developed a bluish tint. What should be the nursing assistant's immediate course of action? Option A. Document the observation and continue with routine care. Option B. Notify the nurse immediately and monitor the resident's vital signs. Option C. Administer oxygen as per the facility's protocol. Option D. Reassure the resident that this is a normal occurrence. The correct answer is option B. Notify the nurse immediately and monitor the resident's vital signs. Explanation. Notify the nurse immediately and monitor the resident's vital signs. This is the safest immediate response and is consistent with the CNA scope of practice. Question 113. The right to file a complaint regarding abuse or neglect, the right to participate in a treatment plan, and the right to manage their financial affairs are all examples of blank and are found in A. Option A. Patient rights/hospital. Option B. Minors rights/mental health facility. Option C. Resident rights/long-term care facility. Option D. All of above. The correct answer is option C. Resident rights/long-term care facility. Explanation. These protections are resident rights established for people living in long-term care facilities. Question 114. A nursing assistant is documenting a resident's condition and notes that the resident appears to be in pain. Which type of observation is this, and how might it affect the care provided? Option A. Objective. It should be prioritized for immediate medical intervention. Option B. Subjective. It may require further assessment to confirm the resident's pain. Option C. Objective. It can be used to make a diagnosis without further evaluation. Option D. Subjective. It is sufficient for documenting the resident's health status. The correct answer is option B. Subjective. It may require further assessment to confirm the resident's pain. Explanation. Appears to be in pain is an interpretation, so it is subjective and should prompt further assessment and objective documentation. Question 115. What is the maximum duration a resident should remain in restraints before being released to ambulate, toilet, or change position? Option A. Every hour. Option B. Every 2 hours or less. Option C. Every 3 hours. Option D. Every 4 hours. The correct answer is option B. Every 2 hours or less. Explanation. Restraints should be released at least every 2 hours or sooner for movement, toileting, repositioning, and safety checks. Question 116. Explain the concept of restorative care in the context of nursing assistance and its importance for residents post-rehabilitation. Option A. It focuses solely on medical treatment. Option B. It aims to maintain and enhance the resident's functional abilities. Option C. It is only relevant for elderly residents. Option D. It replaces the need for rehabilitation services. The correct answer is option B. It aims to maintain and enhance the resident's functional abilities. Explanation. It aims to maintain and enhance the resident's functional abilities is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 117. What is the first step to take when correcting an error in charting as a certified nursing assistant CNA? Option A. Rewrite the entire entry. Option B. Draw a single line through the error. Option C. Delete the incorrect information. Option D. Leave the error uncorrected. The correct answer is option B. Draw a single line through the error. Explanation. A single line preserves the original entry while clearly showing that it was corrected. Erasing or obscuring charting is improper. Question 118. Explain why using a draw sheet is important in preventing skin damage during the movement of residents in a healthcare setting. Option A. It provides comfort to the resident. Option B. It helps maintain the resident's dignity. Option C. It reduces friction and shearing forces on the skin. Option D. It is easier for the CNA to use. The correct answer is option C. It reduces friction and shearing forces on the skin. Explanation. A draw sheet reduces dragging, friction, and shearing while staff reposition a resident. Question 119. A patient requires long-term medication management and nutritional support. Which method would be most appropriate for this patient, and why? Option A. Oral medications and diet, because they are the least invasive. Option B. IV or PICC line, because they allow for continuous administration of medications and nutrition. Option C. Intramuscular injections, because they are quick to administer. Option D. Subcutaneous injections, because they are easier to manage at home. The correct answer is option B. IV or PICC line, because they allow for continuous administration of medications and nutrition. Explanation. An IV or PICC line provides reliable long-term venous access for ongoing medication and nutritional therapy. Question 120. Explain why it is important for a CNA to ensure that alcohol, light, and water are within reach of a resident before leaving them alone. Option A. To prevent the resident from feeling lonely. Option B. To ensure the resident can call for help if needed and stay hydrated. Option C. To comply with hospital regulations. Option D. To encourage the resident to engage in physical activity. The correct answer is option B. To ensure the resident can call for help if needed and stay hydrated. Explanation. To ensure the resident can call for help if needed and stay hydrated. This supports safe, effective, and person-centered resident care. Question 121. Explain why alcohol-based hand rubs are not effective against Clostridium difficile infections. Option A. They do not kill all bacteria. Option B. They are not effective on spores. Option C. They can cause skin irritation. Option D. They are only for routine hand hygiene. The correct answer is option B. They are not effective on spores. Explanation. Alcohol rubs do not reliably destroy C. difficile spores, so hands must be washed with soap and water. Question 122. Explain the difference between physical abuse and neglect in the context of resident care for certified nursing assistants CNAS. Option A. Physical abuse involves intentional harm, while neglect is the failure to provide necessary care. Option B. Neglect is a form of physical abuse that occurs when care is delayed. Option C. Both terms refer to the same type of mistreatment. Option D. Physical abuse is always visible, while neglect is not. The correct answer is option A. Physical abuse involves intentional harm, while neglect is the failure to provide necessary care. Explanation. Physical abuse is intentional bodily harm, neglect is failure to provide required care or protection. Question 123. If a CNA notices that an oxygen tank is not secure upright and is at risk of falling, what should they do to address the situation? Option A. Leave it as is, since it is not their responsibility. Option B. Immediately report it to a supervisor and secure the tank upright. Option C. Move the tank to a different location without reporting it. Option D. Ignore it, as it is not a critical issue. The correct answer is option B. Immediately report it to a supervisor and secure the tank upright. Explanation. Immediately report it to a supervisor and secure the tank upright is the exception. The other choices are recognized signs, components, rights, or recommended practices. Question 124. What is a potential consequence of pressure ulcers in patients? Option A. Increased mobility. Option B, life-threatening infection. Option C, improved circulation. Option D, enhanced skin elasticity. The correct answer is option B, life-threatening infection. Explanation. Open pressure injuries can permit serious infection that may spread and become life-threatening. Question 125. Which one of the following is a true statement about pressure ulcers? Option A, pressure ulcers develop most often in clients with limited mobility. Option B, pressure ulcers cannot be prevented. Option C, pressure ulcers usually occur on the face and hands. Option D, pressure ulcers heal quickly. The correct answer is option A. Pressure ulcers develop most often in clients with limited mobility. Explanation. Limited mobility prevents regular pressure relief, making immobile residents especially vulnerable to pressure ulcers. Question 126. What two items should be placed within reach of a resident before a CNA leaves the room? Option A, coal light and water. Option B, food and medication. Option C, blanket and pillow. Option D, television, remote and phone. The correct answer is option A, coal light and water. Explanation. Coal light and water is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 127. All of the following are signs of hypoglycemia except option A, tremors. Option B, skin flushed, hot and dry. Option C, blurred vision. Option D, hunger. The correct answer is option B, skin flushed, hot and dry. Explanation. Hot, flush, dry skin is more consistent with hypoglycemia. Hypoglycemia commonly causes tremors, hunger, and visual changes. Question 128. What term describes the act of maintaining a false belief despite evidence to the contrary, such as believing one is a famous person? Option A, illusion. Option B, delusion. Option C, hallucination. Option D, misconception. The correct answer is option B, delusion. Explanation. A delusion is a fixed false belief maintained despite evidence that it is untrue. Question 129. What is the universal sign for choking that certified nursing assistants should recognize? Option A, waving hands in the air. Option B, clutching the throat. Option C, pointing to the mouth. Option D, coughing loudly. The correct answer is option B, clutching the throat. Explanation. Clutching the throat is the widely recognized universal sign of choking. Question 130. The most appropriate action to take when a resident talks about suicide is to Option A, report this immediately. Option B, notify your co-workers. Option C, avoid upsetting her. Option D, call the resident's family. The correct answer is option A, report this immediately. Explanation. Any statement about suicide must be reported immediately so the resident can be protected and assessed. Question 131. Explain why it is crucial for CNAs to adhere to protocols regarding oxygen administration. Option A, to ensure that residents receive the correct dosage and avoid complications. Option B, to maintain a good relationship with the nursing staff. Option C, to comply with administrative policies only. Option D, to prevent residents from feeling uncomfortable. The correct answer is option A, to ensure that residents receive the correct dosage and avoid complications. Explanation. To ensure that residents receive the correct dosage and avoid complications. This supports safe, effective, and person-centered resident care. Question 132. What is the recommended position for the head of the bed when a resident has a feeding tube? Option A, flat position. Option B, elevated position. Option C, slightly elevated position. Option D, reclined position. The correct answer is option B, elevated position. Explanation. The head of the bed should be elevated during tube feeding to reduce aspiration risk. Question 133. In a scenario where a resident insists they are going home today despite being informed otherwise, how should a certified nursing assistant CNA apply validation therapy in their response? Option A, inform the resident that they are mistaken and should accept the truth. Option B, agree with the resident and change the subject to distract them. Option C, Listen to the residents' feelings and acknowledge their desire to go home without correcting them. Option D. Provide the resident with a detailed explanation of the discharge process. The correct answer is option C. Listen to the residents' feelings and acknowledge their desire to go home without correcting them. Explanation. Validation therapy focuses on the resident's emotions and meaning without arguing about factual accuracy. Question 134. Which of these statements about pressure ulcers is false? Option A. It takes it about a week for a stage 2 shallow ulcer to evolve to a stage 3 deeper ulcer if pressure continues to be unrelieved. Option B. A stage 1 ulcer is not yet open, just red. Option C. A stage 4 ulcer is open to bone. Option D. Nutrition, hydration, and peri-care are almost as important as pressure relief in resolving pressure ulcers, but they are not a substitute for pressure relief. The correct answer is option A. It takes it about a week for a stage 2 shallow ulcer to evolve to a stage 3 deeper ulcer if pressure continues to be unrelieved. Explanation. Pressure ulcer progression does not follow a guaranteed 1-week timetable. It can occur faster or slower depending on pressure and health factors. Question 135. If a CNA observes a colleague touching a resident who has a visible infection and then immediately attending to another resident without washing their hands, what should the CNA do to address this situation? Option A. Ignore the situation as it is not their responsibility. Option B. Report the incident to a supervisor and remind the colleague about hand hygiene protocols. Option C. Confront the colleague directly and criticize their actions. Option D. Wait until the end of the shift to discuss it with the colleague privately. The correct answer is option B. Report the incident to a supervisor and remind the colleague about hand hygiene protocols. Explanation. Report the incident to a supervisor and remind the colleague about hand hygiene protocols. This is the safest immediate response and is consistent with the CNA's scope of practice. Question 136. If a CNA observes a resident smoking near an oxygen tank, what should be the appropriate course of action? Option A. Ignore it, as it is the resident's choice. Option B. Politely ask the resident to move away from the oxygen tank. Option C. Report the incident to a supervisor immediately. Option D. Join the resident to ensure they are safe. The correct answer is option C. Report the incident to a supervisor immediately. Explanation. Report the incident to a supervisor immediately. This is the safest immediate response and is consistent with the CNA's scope of practice. Question 137. Explain the purpose of the semi-Fowler's position in patient care. Option A. To promote comfort and reduce pressure on the back. Option B. To facilitate breathing and reduce the risk of aspiration. Option C. To encourage mobility and prevent bed sores. Option D. To allow for easier access to the patient's legs. The correct answer is option B. To facilitate breathing and reduce the risk of aspiration. Explanation. Semi-Fowler's supports easier breathing and helps reduce aspiration risk by elevating the upper body. Question 138. A nursing assistant is tasked with creating a reality orientation program for residents with cognitive impairments. Which combination of items would be most effective in this program? Option A. Calendar, clock, familiar pictures, and music playlists. Option B. Television, books, puzzles, and games. Option C. Calendar, clock, familiar pictures, and visual aids. Option D. Posters, magazines, snacks, and plants. The correct answer is option C. Calendar, clock, familiar pictures, and visual aids. Explanation. Calendars, clocks, familiar pictures, and visual cues help residents orient to time, place, and people. Question 139. If a CNA accidentally touches a contaminated surface and then assists a resident without washing their hands, what potential consequences could arise from this action? Option A. The resident will be unaffected as long as the CNA wears gloves. Option B. The resident may develop an infection due to pathogen transmission. Option C. The CNA will be reprimanded, but no harm will come to the resident. Option D. The contamination will be neutralized by the CNA's presence. The correct answer is option B. The resident may develop an infection due to pathogen transmission. Explanation. The resident may develop an infection due to pathogen transmission is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 140. If a resident in a nursing facility insists they are a historical figure and refuses to acknowledge their actual identity, what approach should a CNA take to address this delusion while ensuring the resident feels safe and respected? Option A. Confront the resident and insist they are mistaken. Option B. Agree with the resident to avoid conflict. Option C. Gently redirect the conversation to a neutral topic while providing reassurance. Option D. Ignore the resident's statements and focus on their physical care. The correct answer is option C. Gently redirect the conversation to a neutral topic while providing reassurance. Explanation. Gentle reassurance and redirection avoid confrontation while preserving the resident's dignity and sense of safety. Question 141. Explain the significance of the supine and Fowler's positions in patient care and how they benefit residents. Option A. They are used for comfort only. Option B. They help in respiratory function and comfort during meals. Option C. They are only used for patients with mobility issues. Option D. They are irrelevant to patient care. The correct answer is option B. They help in respiratory function and comfort during meals. Explanation. They help in respiratory function and comfort during meals. This supports safe, effective, and person-centered resident care. Question 142. Why is it critical for certified nursing assistants CNAs to be aware of the concept of elopement in relation to cognitively impaired residents? Option A. To ensure residents have freedom of movement. Option B. To prevent potential harm and ensure resident safety. Option C. To facilitate quicker discharges. Option D. To encourage residents to explore outside. The correct answer is option B. To prevent potential harm and ensure resident safety. Explanation. To prevent potential harm and ensure resident safety is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 143. What type of ROM is done by a staff member without the resident's help? Option A. Active range of motion AROM. Option B. Active assisted range of motion ROM. Option C. Passive range of motion PROM. Option D. Passive active range of motion PAROM. The correct answer is option C. Passive range of motion PROM. Explanation. Passive range of motion is performed by staff when the resident cannot move the joint independently. Question 144. Why is it critical for a certified nursing assistant CNA to report vomitus that resembles coffee grounds? Option A. It indicates a potential gastrointestinal bleed that requires immediate medical attention. Option B. It is a common occurrence and does not require reporting. Option C. It suggests the resident has not eaten properly. Option D. It is a sign of dehydration and can be treated with fluids. The correct answer is option A. It indicates a potential gastrointestinal bleed that requires immediate medical attention. Explanation. Coffee ground vomitus can indicate digested blood from an upper gastrointestinal bleed and requires immediate reporting. Question 145. If a CNA encounters a resident who suddenly becomes combative during a group activity, what should be the first step taken to ensure the safety of all residents? Option A. Immediately confront the resident to assert control. Option B. Call for additional staff support while ensuring other residents are safe. Option C. Ignore the behavior and continue the activity. Option D. Report the incident to the resident's family before taking any action. The correct answer is option B. Call for additional staff support while ensuring other residents are safe. Explanation. Call for additional staff support while ensuring other residents are safe. This is the safest immediate response and is consistent with the CNA scope of practice. Question 146. In a healthcare setting, who is primarily responsible for overseeing the work of certified nursing assistants CNAs? Option A. Registered nurse. Option B. Charge nurse. Option C. Medical doctor. Option D. Nursing supervisor. The correct answer is option B. Charge nurse. Explanation. The charge nurse directs and supervises CNA work during the shift. Question 147. Explain the significance of performing hand hygiene before and after resident contact in a healthcare setting. Option A. It helps to maintain a sterile environment. Option B. It prevents the spread of infections and protects both residents and caregivers. Option C. It is only necessary when dealing with infectious diseases. Option D. It is a personal preference of the caregiver. The correct answer is option B. It prevents the spread of infections and protects both residents and caregivers. Explanation. It prevents the spread of infections and protects both residents and caregivers. This supports safe, effective, and person-centered resident care. Question 148. If a certified nursing assistant CNA notices that they are frequently feeling angry towards residents and struggling to focus on their duties, what steps should they take to address these signs of stress and burnout? Option A. Continue working without addressing the feelings to avoid disruption. Option B. Discuss their feelings with a supervisor and seek support or resources for stress management. Option C. Take a longer break without informing anyone to avoid confrontation. Option D. Ignore the feelings and focus on completing tasks as quickly as possible. The correct answer is option B. Discuss their feelings with a supervisor and seek support or resources for stress management. Explanation. Discuss their feelings with a supervisor and seek support or resources for stress management is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 149. As a CNA in a long-term facility, you will report to Option A. The administrator. Option B. The director of nurses. Option C. The charge nurse. Option D. The housekeeper. The correct answer is option C. The charge nurse. Explanation. The charge nurse is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 150. A resident is experiencing difficulty breathing while lying flat. Which bed position should you place them in to alleviate their discomfort, and why? Option A. Supine, to provide full support. Option B. Lateral, to relieve pressure. Option C. Fowlers, to enhance lung expansion. Option D. Semi-fowlers, to keep them comfortable. The correct answer is option C. Fowlers, to enhance lung expansion. Explanation. Fowlers, to enhance lung expansion, is the recommended position because it best addresses the resident's stated care or safety need. Question 151. Why is it critical for certified nursing assistants to report a resident's suicidal verbalization immediately? Option A. To ensure the resident receives timely mental health support. Option B. To maintain a record of resident behavior. Option C. To prevent the resident from feeling isolated. Option D. To comply with administrative policies only. The correct answer is option A. To ensure the resident receives timely mental health support. Explanation. To ensure the resident receives timely mental health support is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 152. What should you do if you're on fire? Option A. Stop, drop, and roll. Option B. Dump water everywhere. Option C. Try to put it out with an extinguisher. Option D. Pull the fire alarm. The correct answer is option A. Stop, drop, and roll. Explanation. Stop, drop, and roll. This is the safest immediate response and is consistent with the CNA scope of practice. Question 153. Who does the CNA report to? Option A. Head nurse assistant. Option B. Medical director. Option C. Charge nurse. The correct answer is option C. Charge nurse. Explanation. A CNA normally reports resident observations and care concerns to the charge nurse. Question 154. If a CNA observes signs of potential abuse but is unsure, what should be their next step after ensuring the resident's immediate safety? Option A. Discuss their concerns with a colleague and take no further action. Option B. Conduct a personal investigation to gather more evidence. Option C. Report their observations to a supervisor or appropriate authority. Option D. Wait for the resident to disclose any information about the abuse. The correct answer is option C. Report their observations to a supervisor or appropriate authority. Explanation. Report their observations to a supervisor or appropriate authority. This is the safest immediate response and is consistent with the CNA scope of practice. Question 155. Explain the significance of distinguishing between objective and subjective observations in the context of patient care. Option A. Objective observations are more reliable for assessing patient conditions. Option B, subjective observations are always inaccurate and should be ignored. Option C, both types of observations are equally important and interchangeable. Option D, objective observations are based on personal feelings and opinions. The correct answer is option A. Objective observations are more reliable for assessing patient conditions. Explanation. Objective findings are measurable and verifiable, which makes them especially reliable for evaluating changes in condition. Question 156. What term is used to describe the situation where a resident with cognitive impairments leaves a care facility without supervision? Option A, discharge. Option B, elopement. Option C, absconding. Option D, wandering. The correct answer is option B, elopement. Explanation. Elopement is an unsupervised or unauthorized departure from a care facility. Question 157. A resident's blood pressure reading is 150/95. As a CNA, what should be your immediate course of action based on the guidelines for normal blood pressure ranges? Option A, document the reading and continue with care. Option B, notify the healthcare provider and monitor the resident. Option C, reassure the resident that this is a normal reading. Option D, ignore the reading as it is not critical. The correct answer is option B, notify the healthcare provider and monitor the resident. Explanation. A reading of 150/95 is above the expected range and should be reported and rechecked or monitored as directed. Question 158. What is the appropriate action to take when a resident expresses suicidal thoughts? Option A, document it for future reference. Option B, report it immediately. Option C, discuss it with other residents. Option D, ignore it unless it happens again. The correct answer is option B, report it immediately. Explanation. Report it immediately. This is the safest immediate response and is consistent with the CNA scope of practice. Question 159. Why is it important to create a trusting relationship with a new resident and their family during the welcoming process? Option A, it helps to ensure that the resident feels comfortable and secure in their new environment. Option B, it allows the CNA to take control of the situation. Option C, it is a requirement by law for all healthcare providers. Option D, it minimizes the need for communication with the family. The correct answer is option A. It helps to ensure that the resident feels comfortable and secure in their new environment. Explanation. It helps to ensure that the resident feels comfortable and secure in their new environment. This supports safe, effective, and person-centered resident care. Question 160. What is the term used to describe the practice of allowing a resident to maintain their beliefs without correction or confrontation? Option A, reality orientation. Option B, validation therapy. Option C, cognitive behavioral therapy. Option D, supportive communication. The correct answer is option B, validation therapy. Explanation. Validation therapy respects the resident's perceived reality and feelings instead of confronting or correcting them. Question 161. A nursing assistant observes that a resident's skin has developed a mottled appearance. What should be the nursing assistant's immediate course of action? Option A, ignore the observation as it is a normal occurrence. Option B, document the observation and monitor the resident closely. Option C, apply lotion to the affected areas. Option D, immediately call for a physician without further assessment. The correct answer is option B, document the observation and monitor the resident closely. Explanation. Mottling can signal poor circulation or decline, so it should be documented, closely monitored, and promptly communicated to the nurse. Question 162. What is the appropriate action to take if a resident's vomitus appears similar to coffee grounds? Option A, monitor the resident for additional symptoms. Option B, report to the nurse immediately. Option C, administer medication as prescribed. Option D, document the observation in the resident's chart. The correct answer is option B. Report to the nurse immediately. Explanation. Coffee ground emesis may represent gastrointestinal bleeding and must be reported to the nurse immediately. Question 163. What is a potential consequence of poor circulation in diabetic residents that necessitates careful foot care? Option A, increased risk of infection. Option B, enhanced healing of wounds. Option C, improved mobility. Option D, reduced sensitivity in feet. The correct answer is option A, increased risk of infection. Explanation. Poor circulation slows healing and raises the chance that a minor diabetic foot injury will become infected. Question 164. Explain why it is important to check on restrained residents every hour or less. Option A, to ensure they are comfortable. Option B, to prevent skin breakdown and ensure safety. Option C, to provide medication. Option D, to assist with meals. The correct answer is option B, to prevent skin breakdown and ensure safety. Explanation. Frequent checks help detect impaired circulation, discomfort, skin damage, or other restraint-related hazards early. Question 165. What is the name of the bed position that raises the head of the bed to 30-45 degrees? Option A, supine. Option B, prone. Option C, semi-Fowlers. Option D, Trendelenburg. The correct answer is option C, semi-Fowlers. Explanation. Semi-Fowler's position raises the head of the bed approximately 30 to 45 degrees. Question 166. A resident in a long-term care facility has developed contractures in their hands due to limited mobility. As a CNA, what intervention would be most appropriate to help manage this condition? Option A, encouraging the resident to perform daily exercises to improve flexibility. Option B, restricting movement to prevent further injury. Option C, applying heat packs to the affected areas for relief. Option D, increasing the resident's medication dosage to alleviate pain. The correct answer is option A, encouraging the resident to perform daily exercises to improve flexibility. Explanation. Encouraging the resident to perform daily exercises to improve flexibility is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 167. Explain why cyanosis occurs in patients and what it indicates about their oxygen levels. Option A. It indicates a lack of blood flow to the skin. Option B. It suggests an increase in carbon dioxide levels in the blood. Option C. It reflects a deficiency in oxygenation of the blood. Option D. It shows that the patient is experiencing an allergic reaction. The correct answer is option C. It reflects a deficiency in oxygenation of the blood. Explanation. Cyanosis develops when blood is inadequately oxygenated, producing a blue tint in skin or mucous membranes. Question 168. Explain why water is regarded as the most essential nutrient for individuals in a healthcare setting. Option A. It provides energy for daily activities. Option B. It aids in the absorption of other nutrients. Option C. It is crucial for maintaining hydration and bodily functions. Option D. It helps in the healing of wounds. The correct answer is option C. It is crucial for maintaining hydration and bodily functions. Explanation. It is crucial for maintaining hydration and bodily functions. This supports safe, effective, and person-centered resident care. Question 169. When assisting with eyeglasses, what should you do? Option A. Make sure they are clean and placed on the resident appropriately. Option B. Don't use them if the resident may misplace them. Option C. Don't use them if a family member doesn't want the resident to wear them. Option D. Don't place them on confused or disoriented residents. The correct answer is option A. Make sure they are clean and placed on the resident appropriately. Explanation. Make sure they are clean and placed on the resident appropriately. This is the safest immediate response and is consistent with the CNA's scope of practice. Question 170. Touching an infected person and then touching another person without washing one's hands is called. Option A. Standard precautions. Option B. Direct contact. Option C. Reservoir. Option D. Droplet precautions. The correct answer is option B. Direct contact. Explanation. Person-to-person transfer by touch is direct contact transmission, especially when hand hygiene is omitted. Question 171. Why is it important for a caregiver to position a resident on their side during a seizure? Option A. To prevent choking and ensure airway safety. Option B. To make the resident feel more comfortable. Option C. To allow for easier monitoring of vital signs. Option D. To facilitate communication with the nurse. The correct answer is option A, to prevent choking and ensure airway safety. Explanation. Side positioning helps secretions drain and reduces choking or aspiration while protecting the airway during a seizure. Question 172. Explain how pressure ulcers can contribute to the chain of infection in a healthcare setting. Option A, they provide a barrier to infection. Option B, they create a portal of entry for pathogens. Option C, they enhance the immune response. Option D, they reduce the risk of infection transmission. The correct answer is option B. They create a portal of entry for pathogens. Explanation. A pressure ulcer breaks the skin and creates a portal through which pathogens can enter the body. Question 173. If a caregiver encounters a resident having a seizure in a crowded room, what steps should they prioritize to ensure the resident's safety? Option A. Call for help, restrain the resident, and clear the area. Option B. Stay with the resident, move furniture away, and ensure the area is clear. Option C. Leave the room to get assistance and return quickly. Option D. Loosen the resident's clothing and call for a nurse only after the seizure ends. The correct answer is option B. Stay with the resident, move furniture away, and ensure the area is clear. Explanation. Stay with the resident, move furniture away, and ensure the area is clear is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 174. What is the primary function of personal protective equipment PPE in a healthcare setting? Option A. To enhance the caregiver's comfort during procedures. Option B. To provide a barrier against pathogens and prevent infection spread. Option C. To improve communication between caregivers and residents. Option D. To ensure compliance with healthcare regulations. The correct answer is option B. To provide a barrier against pathogens and prevent infection spread. Explanation. To provide a barrier against pathogens and prevent infection spread is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 175. What is the definition of contractures in the context of patient care? Option A. A temporary loss of muscle function. Option B. Permanent stiffening of a joint or muscle. Option C. A type of muscle spasm. Option D. An inflammation of the joint. The correct answer is option B. Permanent stiffening of a joint or muscle. Explanation. A contracture is permanent shortening and stiffening that limits normal movement of a joint or muscle. Question 176. Which of the following is not a sign of hypoglycemia? Option A. Cold/clammy skin. Option B. Double or blurry vision. Option C. Increased thirst. Option D. Shaking or trembling. The correct answer is option C. Increased thirst. Explanation. Increased thirst is more typical of hypoglycemia. Hypoglycemia commonly causes clammy skin, visual changes, and shaking. Question 177. What is a common time frame for the occurrence of most pressure ulcers in patients? Option A. Within a few days of admission. Option B. Within a few weeks of admission. Option C. After several months of care. Option D. Immediately upon admission. The correct answer is option B. Within a few weeks of admission. Explanation. Many pressure ulcers develop early in a stay, often within the first few weeks when risk factors are not rapidly addressed. Question 178. If a CNA notices a resident has loose, chipped teeth, and a coated tongue during oral care, what should be the CNA's immediate course of action? Option A. Ignore the findings as they are not serious. Option B. Document the observations and continue with the oral care. Option C. Report the findings to the nurse for further assessment. Option D. Advise the resident to brush their teeth more frequently. The correct answer is option C. Report the findings to the nurse for further assessment. Explanation. Report the findings to the nurse for further assessment. This is the safest immediate response and is consistent with the CNA scope of practice. Question 179. What does the acronym PASS stand for in the context of fire safety procedures? Option A. Pull pin, aim nozzle, squeeze handle, sweep back and forth at base of flame. Option B. Prepare area, assess situation, secure equipment, summon help. Option C. Position alarm, activate system, sound warning, secure exits. Option D. Prevent accident. Assess risk. Safety first. Stay alert. The correct answer is option A. Pull pin, aim nozzle, squeeze handle, sweep back and forth at base of flame. Explanation. PASS stands for pull the pin, aim at the base, squeeze the handle, and sweep side to side. Question 180. Why is it important for certified nursing assistants to recognize the universal sign for choking? Option A. To ensure they can provide emotional support. Option B. To initiate appropriate emergency procedures quickly. Option C. To inform other staff members. Option D. To assess the resident's overall health. The correct answer is option B. To initiate appropriate emergency procedures quickly. Explanation. To initiate appropriate emergency procedures quickly. This supports safe, effective, and person-centered resident care. Question 181. Which of the following is not a way to welcome a new resident according to the provided information? Option A. Prepare the room for the resident's arrival. Option B. Introduce yourself to the resident and their family. Option C. Provide medical treatment immediately upon arrival. Option D. Create a trusting relationship with the resident. The correct answer is option C. Provide medical treatment immediately upon arrival. Explanation. Provide medical treatment immediately upon arrival is the exception. The other choices are recognized signs, components, rights, or recommended practices. Question 182. Which of the following is not considered a resident's right according to the guidelines for certified nursing assistants? Option A. Voice grievances. Option B. Self-administer medications. Option C. Be free from abuse. Option D. Be required to follow all staff orders. The correct answer is option D. Be required to follow all staff orders. Explanation. Residents have rights and choices. They are not required to obey every staff order without question. Question 183. What is the primary method recommended for preventing the spread of infection in healthcare settings? Option A. Use gloves. Option B. Wash hands. Option C. Disinfect surfaces. Option D. Isolate infected patients. The correct answer is option B. Wash hands. Explanation. Hand washing is the most effective routine measure for reducing transmission of infection in healthcare settings. Question 184. Why is it important for certified nursing assistants CNAs to understand the concept of misappropriation in their role? Option A. To ensure they can provide medical care effectively. Option B. To maintain trust and respect between residents and caregivers. Option C. To improve their chances of promotion within the facility. Option D. To comply with state regulations only. The correct answer is option B. To maintain trust and respect between residents and caregivers. Explanation. To maintain trust and respect between residents and caregivers. This supports safe, effective, and person-centered resident care. Question 185. A CNA is about to assist a resident with a bathing procedure. Which of the following actions should the CNA take regarding hand hygiene before starting the task? Option A. Wash hands only after the procedure is completed. Option B. Perform hand hygiene before resident contact and before the aseptic task. Option C. Use hand sanitizer after touching the resident's belongings. Option D. Skip hand hygiene if gloves are being worn. The correct answer is option B. Perform hand hygiene before resident contact and before the aseptic task. Explanation. Perform hand hygiene before resident contact and before the aseptic task is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 186. What term describes the phenomenon where a resident exhibits increased confusion or agitation during the evening hours? Option A. Nocturnal delirium. Option B. Sundowning. Option C. Evening agitation. Option D. Daytime clarity. The correct answer is option B. Sundowning. Explanation. Sundowning is increased confusion or agitation that appears or worsens in the late afternoon or evening. Question 187. A resident in a long-term care facility is exhibiting symptoms such as cracked lips and dark urine. As a CNA, what immediate action should you take to address these symptoms? Option A. Increase the resident's fluid intake and monitor their hydration status. Option B. Report the symptoms to the nurse and document them in the resident's chart. Option C. Provide the resident with a high-sugar snack to boost energy. Option D. Encourage the resident to engage in physical activity to stimulate appetite. The correct answer is option A. Increase the resident's fluid intake and monitor their hydration status. Explanation. Cracked lips and dark urine suggest dehydration, so fluids should be encouraged when permitted and the resident's hydration status monitored and reported. Question 188. Explain why the semi-Fowler's position is considered to exert less pressure on the coccyx compared to the Fowler's position. Option A. It elevates the legs. Option B. It reduces the angle of hip flexion. Option C. It allows for better spinal alignment. Option D. It decreases the overall body weight on the coccyx. The correct answer is option B. It reduces the angle of hip flexion. Explanation. The lower angle in semi-Fowler's reduces hip flexion and sliding, decreasing pressure and shear over the coccyx. Question 189. The normal pulse range for adult clients is how many beats per minute? Option A. 60 to 100. Option B. 90 to 100. Option C. 80 to 120. Option D. 90 to 120. The correct answer is option A. 60 to 100. Explanation. The standard resting adult pulse range commonly taught is 60 to 100 beats per minute. Question 190. What is one method by which infections can be transmitted in a healthcare setting? Option A. Using shared medical equipment without disinfection. Option B. Touching an infected person and then touching another person without washing hands. Option C. Administering medication without proper training. Option D. Failing to document patient care accurately. The correct answer is option B. Touching an infected person and then touching another person without washing hands. Explanation. Touching an infected person and then touching another person without washing hands is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 191. The resident is allowed to choose. Option A is bath time. Option B is clothing. Option C, the time he gets up and goes to bed. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Person-centered care allows residents to choose routines such as bathing, clothing, waking, and bedtime whenever possible. Question 192. Which of the following documents provides responders with specific information about a chemical, such as first aid procedures or chemical characteristics? Option A, Emergency Response Guidebook. Option B, NFPA 704. Option C, Bill of Shipping. Option D, MSDS. The correct answer is option D, MSDS. Explanation. An MSDS contains chemical properties, hazards, required protective equipment, first aid, and emergency procedures. Question 193. What information must be included when giving an end-of-shift report? Option A, the full name and address of the resident. Option B, facts and specific information that were observed and care given by the CNA. Option C, number of visitors. Option D, personal feelings about the resident. The correct answer is option B, facts and specific information that were observed and care given by the CNA. Explanation. Shift report should contain factual observations, changes in condition, and care provided, not opinions or irrelevant personal details. Question 194. Explain how improper cleaning of the peri area can affect a resident's health. Option A, it can lead to increased comfort and satisfaction. Option B, it may cause skin irritation but not affect overall health. Option C, it can facilitate the entry of pathogens into the urinary tract, leading to infections. Option D, it has no significant impact on health. The correct answer is option C. It can facilitate the entry of pathogens into the urinary tract, leading to infections. Explanation. It can facilitate the entry of pathogens into the urinary tract, leading to infections is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 195. Explain how indirect contact can facilitate the spread of infections in a healthcare setting. Option A, by ensuring that all surfaces are disinfected regularly. Option B, through the transfer of pathogens from surfaces to individuals without proper hand hygiene. Option C, by promoting the use of hand sanitizers over hand washing. Option D, through the immediate isolation of infected patients. The correct answer is option B, through the transfer of pathogens from surfaces to individuals without proper hand hygiene. Explanation: through the transfer of pathogens from surfaces to individuals without proper hand hygiene is the correct choice based on standard CNA safety, infection control, resident rights, and scope of practice principles. Question 196. A resident has been diagnosed with dysphagia and requires thickened liquids. If a nurse mistakenly serves them regular juice instead of a thickened option, what potential complications could arise? Option A. The resident may enjoy their meal more. Option B. The resident could experience choking or aspiration. Option C. The resident will have better hydration. Option D. The resident will not notice the difference. The correct answer is option B. The resident could experience choking or aspiration. Explanation: thin liquids can enter the airway more easily in dysphagia, causing choking or aspiration. Question 197. Explain the concept of sundowning and its potential impact on the care provided to residents in a nursing facility. Option A. It refers to a decrease in resident activity during the day. Option B. It is a term used for residents who sleep excessively at night. Option C. It describes behavioral changes that occur in the evening, affecting care routines. Option D. It indicates a resident's preference for evening meals. The correct answer is option C. It describes behavioral changes that occur in the evening, affecting care routines. Explanation: sundowning refers to evening behavioral or cognitive worsening that can disrupt care routines and increase supervision needs. Question 198. Explain the significance of maintaining blood pressure within the normal range for residents in a healthcare setting. Option A. It helps in diagnosing chronic diseases. Option B. It ensures the effectiveness of medication. Option C. It reduces the risk of cardiovascular complications. Option D. It is irrelevant to overall health. The correct answer is option C. It reduces the risk of cardiovascular complications. Explanation: it reduces the risk of cardiovascular complications. This supports safe, effective, and person-centered resident care. Question 199. Elevating the head of the bed for a resident that is receiving a tube feeding prevents. Option A. Aspiration. Option B. Constipation. Option C. Flatulence. Option D. Pressure ulcers. The correct answer is option aspiration. Explanation: head of bed elevation helps prevent tube feeding formula from being aspirated into the lungs. Question 200. Explain how recognizing signs of stress and burnout can impact the quality of care provided by certified nursing assistants (CNAs. Option A. It allows CNAs to ignore their feelings and focus solely on their tasks. Option B. It helps CNAs to identify when they need to take a break and seek support, ultimately improving resident care. Option C. It encourages CNAs to complain more about their responsibilities. Option D. It has no effect on the quality of care provided. The correct answer is option B. It helps CNAs to identify when they need to take a break and seek support, ultimately improving resident care. Explanation: recognizing burnout allows CNAs to seek support and recover before stress harms judgment, communication, or resident care.